my doctors, who are also researchers, they wanted my tumor. So I, of course, was very glad to give them my tumor. And they proceeded to start doing a lot of research on it. I didn't even realize how much until I was working on this documentary. To this day, there's all kinds of studies going on my tumor. So the importance of the BRCA mutation. So after my case, they first decided to test to see how many people had BRCA in new cases of pancreatic cancer. And it was more than they thought. It was 4 or 5% of the new cases involved a BRCA mutation. So that was the first thing they figured out. And what they also figured out was that people who had pancreatic cancer with a BRCA mutation responded better to treatment than everybody else. And they even went back and thought of some older cases they had, and they said, you know, there were a number of people that really confounded us, and they lived longer than we really thought they would, and they figure some of those people may have had BRCA mutations like I do. And there were various trials on the way to treat these people, and so the drug gemcitabine, which was the standard, plus cisplatin, what I had, or those experimental drugs, which I couldn't get, but which are now standard, that became the standard of care for people with that mutation. And the significance of that for everybody else is that the way that cancer works now is personalized medicine. So they try to treat everybody not according to the body part where the cancer is, but the genetic characteristics of the tumor. And they try to divide it into subsets where different people's tumors, they may look the same, but they have different genetic characteristics. So with pancreatic cancer, this is really the first subset where they figured out a path to treatment. And you know, once there's one, there can be others. Having said that, I still have done better than most people, even with a BRCA mutation, even if they do better than most other people. So the scientists, the researchers, the doctors are trying to figure out why. And that is what part of the research on my tumor is. They've also tried to figure out if there are other drugs that work with it. And apparently my tumor responds to all kinds of drugs. So that is very good news. So that's basically what they're figuring out. And you know, I read recently that even with ALS, very deadly disease, the same thing seems to have happened, where there's been a breakthrough for people who have the hereditary form of MS that's passed down because of a gene. And it's only a small percentage of the cases, or about 5%, actually not that small. But what the hope is that, you know, once they make the first dent and they figure out the first subset, the others will follow. So what is continuing in pancreatic cancer is they're trying to identify other subsets so they can treat them. They're also looking at my particular tumor to see what, you know, why have I been able to survive so long without getting sick again when really most people do.